Còn bên kia của môn pháp Việt sẽ có họ có share bên nhau.
Họ làm bởi vì làm cái như vậy tương tự với mình. Họ làm trong cái như vậy thì sao cái đấy mình có thể làm hai cái thì là giống
This is wonderful. I'll give this to Michelle.
tức là mình sẽ lấy sinh viên đến cá nhân khi đến từ pháp nào
You're good? Anything, just text me. Thank you.
Did you want us to wait for the
Oh, no, you can start. I'll just be taking.
Are we waiting? I think we were scheduled for 12 minutes. I'm going to give you a little bit of time to relax.
Cho mình một số công việc thư giãn sau ăn không? 5 minutes, okay?
Yeah, what do you mean?
Okay, yeah.
Or would you like 5 more minutes?
Muốn bắt đầu bây giờ chứ hay là muốn nghỉ mấy phút sau khi ăn?
Yeah, we can start.
Okay. So I already met all of you now, Michelle, and I just thought we'd start with just seeing how you go on with pace and delivery. I was only here for a few minutes when Connor spoke, but are you understanding okay? Do you need me to speak slowly? Would you like to, I'm having difficulty understanding, perhaps one of you can translate as well if need be. Just checking in that you're doing okay with the pace, with the speed of the delivery that Connor was using this morning. Is it going okay?
Yes, it's okay.
Yeah,
with the speed is fine.
Terrific. Feel free to let me know if you need them to repeat anything or you can hear them. And if I've got a soft voice, so hopefully you can hear me okay.
Okay, cool. Sorry, we could interrupt you.
Absolutely, I would love you to do that. I'm very relaxed about that. I'm just going to pull the keyboard a bit closer so I can, if it's okay, I'll stand.
Yeah.
That's my old lady back. Thanks, Elvira. So this is one of the sessions, just also to give me an idea, were any of you able to complete the online module for this session, the clinical teaching?
Yes.
Someone? Excellent. So you will, have you prepared a 5-minute micro teaching session? Have you prepared already to a session to do for the micro teaching? Piece of paper
This
there?
one?
Yes.
So I have read through it.
Yes. So have you prepared something so that you're ready to do that? Because that's one of the activities that you will actually break into pairs and do the teaching, or because we're a small group, we could do it where you, if you want all of us to listen and provide feedback, we can do that as well. And the idea, it doesn't have to be a medical topic, I don't think, from memory, but something that you would normally teach, and where you just, but you have only 5 minutes, and so you will use the framework that you learnt about in your online module, and then you practice, and then your colleague will give you feedback on your teaching. Is that something you feel comfortable? It doesn't have to be everybody, but maybe a few of you, will you be comfortable to do that later, or would you like a few minutes now to prepare for that?
Yes, you give us service now to prepare for us.
Yeah.
In fact, we have learned through, with me, I don't know with my colleagues, but
Yes.
I have learned through the pre-program online,
yes.
but I have not practiced on this in my
Okay,
class.
that's okay. You might have missed it. Sometimes it's embedded, like a link that you have to click on to see that information. So we can either give you time now, or when we get to the activity, and you've already seen some of the background, then we can give you 5-10 minutes to prepare something to
Yes, okay.
practice teaching. It's not to make anybody feel uncomfortable.
Yeah.
It is just a nice opportunity to actually get feedback. We don't often get feedback on our teaching. Do you have a formal peer review process where a peer will sit and give you feedback on how you're teaching? No, and we, I've been teaching for many, many years and I've rarely had that kind of feedback. We're getting it more established now because I think peer teaching together and then getting feedback from your peers is really helpful. But this is just an opportunity to practice that today. So again, I think we have plenty of time, so we can give you a little bit of time to prepare that a little bit further into the conversation. All right, so we'll make a beginning, and really this clinical teaching, you have all been teaching, I'm sure, for many years, and you can probably teach me many things about teaching. We're taking you through a program that I kind of may have explained. We use for our clinical supervisors in hospitals, more junior doctors who aren't academics, who haven't had the educational theory, they haven't done a course in education. Inherently, as medical practitioners, as allied health practitioners, we have been taught, we've gone through med school or through our courses, and we have been learners, and we've been taught by teachers, but most of those teachers were clinicians, not teachers. And so we are trying to build the education capacity, the education skills of the very many clinicians and allied health professionals that teach our students. So this course isn't going to be a high-level academic thing for people, for experienced academics like yourself. It is designed for bedside teaching, for that small group teaching, for people who don't have that academic background to teaching. And it uses a couple of established evidence-based techniques for that, and we'll expose you to 2 or 3 of those today. Okay? So the learning objectives are the learning outcomes. Hopefully by the end you'll be able to explore, we'll have an opportunity to practice in our teaching some of the adult learning principles. We'll use which we will show you in a minute, the set dialogue closure. It's an easy way to think about if you're preparing a small teaching segment, but it's also useful for a longer teaching segment as a structure for how you can structure your teaching. And to practice teaching with feedback, that would be the micro teaching session, and just to increase your confidence with teaching, although, as I said, I'm sure that you're very confident teachers. So just to begin with, and I think I'll use the board over here perhaps, I want you to have some conversation in pairs for a couple of minutes around maybe this side of the table, maybe the 3 of you could think about what were the things that you experienced as a learner that weren't helpful, that you didn't find helpful in your teachers. And for this side, the things that you found really useful and helpful and were good teaching practices. Just discuss maybe the 3 together, and then we'll feed back to the group and we'll write a few things down. So, what did you find effective and what did you find ineffective? Probably take 3 or 4 minutes.
Học á, thì bây giờ mình phải ra cả cái thảo luận kia dài, nhưng mà mình phải nói không quên. Vậy là lắng nghe hả? Cái kỹ thuật dài là thuyết trình nè. Giúp nhân mà hấp dẫn cái quan trọng, giúp hấp dẫn cái hiệu quả. Hiệu quả.
Thì nói chuyện một chiều nó cũng giảm
Thuyết dài hả?
Cách mắng la cái chuyện la cái suy nghĩ này sắp vào về học cái học động sự
Kỹ thuật dài mà no assessment là không chủ dài hả? Chứ muốn là cái kỹ thuật dài mà nó không hiệu quả. Okay, mình sẽ speak in nè.
kinh nghiệm nữa.
Dân thai nè, dân thai không hiệu quả. Ok. Thủ tục người khác. Ok. Giống như là về tài chung á, làm về tài chung á. Về tài chung. Ok. Không mình có hai cái là speaking, teaching. Kỹ thuật. Đừng quên gameful.
Đó, cái đầu tiên thôi. Nhưng mà ba cái mình biết là game full learning, game based learning, game gamification. Em vẫn chưa biết sự khác biệt bạn đó là nhân lại là too much process.
Cho nên người sinh viên nói mà người thầy phản hồi lại nó đúng hay sai là bằng hiệu quả.
We haven't finished like this all the time, so maybe always start with the positive. So I think you're looking at what was helpful. Is that correct?
Yeah.
Well, what would you say you found helpful as a learner? What were the characteristics of the teachers that you found helpful?
We iterate game, gameful,
Gameful, playful, very interesting. Yeah. So game. They have a game. Gamification, we call it. Yeah, and we have some examples of that at Bond. We have an escape room. Does anyone talk to you about the escape room? And that's a lot of fun. Yeah, that's a great answer.
As a learner, I think when I play the role and when I being in the realistic
Yes.
situation or circumstance,
Yes.
so it makes me know the practical
It's more practical, so you prefer an authentic learning experience to made up like a role play?
Yeah,
Like
role play
understanding
or
role play?
like simulation.
So do you think that sim and role play is useful, or you prefer the real patient experience? Or both have a purpose?
So I prefer role play and simulation before I learn.
So a graded exposure, yes, so time to practice in a simulated environment, so like a stepped approach, so role play. Sorry, my writing is very messy. I don't practice much anymore. I'm writing on the board. Sim first before a real patient. And I mean, in educational terms, we call that keeping someone in the, we would call that keeping someone in that zone of proximal development where they are not being stretched too far, too fast in their learning, yeah? Because we all want to need to be challenged, but not so challenged that we fail, yeah? So that's a great point, yeah. Any other thoughts about what you found helpful?
Competency, space, teaching.
Competency-based teaching, yeah, so the teachers actually work, so help me understand, and you mean that the teacher had the skills they were trying to teach you? They were experts in their field, or are you saying teaching people to achieve a particular outcome rather than a didactic kind of teaching? Is that or the second one, the latter? Yeah, it's a competency-based teaching. Yeah. Thank you. And we certainly have like competency-based assessment, don't we? So it makes sense that we teach in that way. Any other thoughts about helpful things?
So we ask questions.
Yeah, good questions.
Yeah, good questions. And stimulate them to think deeply,
Yes.
actively.
Yes. Yes. So, yeah, good questions.
Often critical thinking.
Deep learning. Yeah, good one. Yeah, you can make it. Maybe. Any other thoughts? The other side can answer about good things too. If good things come to mind.
Problem-based solving.
Yeah. Yeah.
Uh,
I'll abbreviate for our education crowd, PBL.
I wonder that PBL is similar to the upper item that I suggest.
This one here?
No, the
No,
question.
the good
question.
The good question.
Good questions.
So we ask the student questions and they learn through answering that question. Is that PBL?
PBL, you start with a problem, so you start with the clinical scenario. I've got chest pain, and then what will I? That's how we generally in Australia would refer to PBL, and they mean different things. Good questions is basically I'm not telling you what to know.
Theoretical.
Help you figure out. You know, I'll say what do you know
Yeah.
about this topic, and get you to answer what you know and build on your existing knowledge, and then ask you more questions rather than saying these are the 5 things you need to know about chest pain. Yeah. Yeah.
The same with the place-based learning.
Yes, it's similar. Yeah, so very, and there's lots of overlapping. Yeah, thank you. I'm going to trip over. I know. There's lots of overlap between every university comes up with a new way, and then they put, they publish a paper and put their name on that technique. There's a lot of overlap between case-based and problem-based. Problem probably is a little bit narrower. You might have in a case-based, you might have multiple problems that you're addressing, whereas a problem sort of start the stimulus is one thing, and then you go from there. Makes sense? I'm sorry, I think you had a comment at the back.
I try to talk heavy learning that theory.
Somebody stole your idea. That's good. All right. Any other thoughts quickly around good techniques? Helpful.
Peer learning.
Yeah, absolutely. Yeah. So that's something you found effective? And I mean, that's what we're doing now. We're learning as peers, aren't
Yeah,
we?
they can reflect from their peer.
Yeah, and the reflection as well. Meet teachers who help you to reflect. It's a very powerful learning tool, isn't it? As if we don't reflect, we're really not learning. Yeah. Any other thoughts about good techniques or effective techniques? You're doing really well. You've got 10 out of 10 already, so now you're going for the bonus prize.
I think we should get students feedback
Yes.
after teaching.
Yes. So you're actually asking, the teacher's asking for feedback. That's great. Well, I think I've run out of room on the effective side. What about ineffective, unhelpful? Techniques? What
One
are you-
way lecture.
Lectures.
Yes.
But we love lecturing, don't we? We feel so powerful when we lecture. Yeah. Nobody wants to be lectured to, not even children. Not my children.
Teamwork without control, without management.
Sorry, I missed the first word.
So teamwork
Teamwork.
without control.
Without
Without
control.
control.
Mhm. So give me an example.
Example, so we give the task for a group of students,
Yes.
but we cannot manage some students, but so finally only some student only solve this task.
Yes.
The other do not.
I love that, yes, and my children are young adults
Yeah.
now, but in university their number one complaint was
Yeah.
group projects
Yes.
where not everybody contributes.
Yes.
So it's, teamwork's great if the team works, but dysfunctional teams or lack of support for teams maybe.
in collective teamwork.
Yeah, yeah. You've got to set up some guiding principles, don't you, for teamwork?
Question and answer, could you please explain more about the question answer that's not in fact?
Oh, yeah, like we use a question and answer, like some lecturer, they just keep asking question, but no guideline or no, like, so it's, they abuse it, so the student have to answer so many questions, but then, what is the final takeaway, like, message is not clear, and it's not detailed enough, and
So, lots of questions, but no synthesis or the volume of questions.
Yeah, the volume.
And it can feel very much like you're being targeted with, you know,
yes.
you must perform. Yeah, so too many questions and a lack of synthesis, I think, or synthesizing it. I think, sorry, that's my symbol, without synthesis, without, I think also without that, I think I heard you say like the take home message, what are the key points? Yeah, oops, that's very messy, sorry. Key points, yeah. And that will come out later in the session. Any other things that, in this side of the room as well, if there have been things that you've seen or that you've done that you think are very effective teaching techniques, what would they be?
Did not provide them,
Ineffective, sorry.
yes, effective, like, when we did not provide them the goal.
No, yeah, so they don't have the learning objectives or goals, yeah, so they're completely defined. Do you use LOs? Everyone will know, learning objectives, yep.
No assessment?
Yeah, like an assessment, so no way to feed, you don't know how you're going in your learning, so like an assessment. Even though I think students might like that on the surface.
No separate teaching plan?
Like a plan, yeah. Should just say like a plan, teaching plan specifically. Did you do learning plans with Connor this morning?
Yes.
Yeah. Anything else?
Unlogical.
Illogical? Yep. Doesn't make sense, that's not going to be helpful, is it? It's like my asking you about helpful things, when I wanted to know unhelpful things. Any other thoughts? You've done pretty well. Run out of ideas? Or at least time. Okay, so you already mentioned very many, or in the helpful side, many things that are useful in our learning, and so there are a number of principles that we've already touched on, but obviously are learner-centered, so you know that lectures aren't particularly learner-centered, are they? You're not catering to an individual learner in any way, and we find that unhelpful. It means that you're balancing, like you were discussed in your learning plans, you're balancing the learner's needs, what your outcomes are that you want, and the content is relevant for the learners. Setting clear goals, that's already come out, clear outcomes is really important, and making sure that the information is relevant, practical, and useful to the learner. That includes pitching it at the right level, like you were talking about, they need practice at this level before you're asking them to achieve this level. Making content connections, and the way we think about this is I like to start with a group of new students, starting with what they do know and then connecting that. What have you experienced? Maybe they haven't seen this type of patient, but they have seen this type, and it's actually, you know, drawing back to their previous learning and building on that rather than them feeling like they're starting from scratch. So making connections between the content back to relevant, authentic experiences that they can learn from. Promoting their involvement, so that's definitely not lectures, is it? Making sure that you're engaged. While it can be uncomfortable when I say will you teach, you know, when you practice your 5-minute teaching in a group, it's easier just to sit and nod and, you know, be listening to me talk, but you're going to learn a lot more if you practice it and you're actively involved as an adult, and I think everybody learns better if they're involved. You've mentioned feedback and the importance, so if you just are left to go without any feedback, you're not going to have a very good learning experience. They're very obvious things. And then facilitating learning. So you want the learning to motivate and challenge and provide meaning and build on new knowledge. There's lots of things, and you mentioned that kind of deep learning and the deep thinking that you need versus this didactic approach, where you just want to transmit information. This workshop isn't about me teaching, about clinical teaching, it's about you together learning from each other. And you'll learn, you mentioned peer learning before, you learn much more from your peers than you're going to learn from somebody lecturing you from the front of the room. And then lastly, allowing that time for reflection, which is also come up. And this is something that as we're training our students when they graduate from medicine, they need to be lifelong learners, but they also need to know how to reflect. And all of our, I'm sure you have it as well, the continuing professional development is now building in mandatory self-reflection opportunities for certainly our Australia, New Zealand colleges, and I don't know if that's part of your professional learning, is that you must, reflect on your learning and your learning needs and gaps. So we're going to watch a video, if I can make it work, and we're going to show you just a little scenario, and then I'm going to show you two different versions. And it's fairly obvious, but we're going to get you to critique what you see, where you see some of these adult, if I go back to these adult learning principles. I want you to see in the video where you can see some examples of where these principles have been used effectively, but also make some notes or jot down examples of where you think it wasn't effective and could have been done better. They're role plays. So, they're not authentic situations, so don't feel worried for the patient in the situation, but observe, and we'll have some little time at the end to feedback on whether they were helpful or ineffective teaching techniques. I must have very long legs, this chair is very high. Yes, I can. I just haven't taken the time to. I'll try not to fall over. Okay, so this one just sets the scenario. I just have to turn up the volume.
Yes, unfortunately.
Loud enough?
Bill, do you mind if Dr. Polanski here asks you a few questions?
No, it's fine, go ahead.
Bill, I understand you're 78 years old and you were diagnosed with COPD 10 years ago. You stopped smoking 5 years ago, and when you came in to see Dr. Brennan about 4 weeks ago, you had been fine for 6 months. What's happened since then?
I developed a cold about 4 weeks ago. Went to my chest, having trouble breathing, an increased phlegm. I went to see my GP about a week ago, and he suggested more puffers. I've been taking my puffers hourly. That didn't seem to make any difference.
Have you noticed anything else, any sort of chest?
I get chest pains, the front of my chest, my cough, and phlegm seems to increase.
And are you able to get around much?
Not as much as I used to be able to do.
Any more questions, Bill?
No, I think we've covered most. Thank you.
Bill, what are you normally able to do? Go to the letterbox, go to the toilet?
I can walk down the letterbox a couple of times a day. Go to the toilet and shower myself. I'm not particularly doing that now. My neighbours have come in and helped me.
And what colour is your phlegm?
It's now turned yellow.
And have you noticed any fever?
No.
Okay. Then you just
that's just the introduction, and then I'll show you two different versions of the teaching component. So this is the first one. Do you need it any louder?
So what do you find on examination?
He has increased pulse rate and respiratory rate. I couldn't see his JVP. He has a hyperextended chest and a prolonged expiration, and there's some crackles in the left base.
So what do you think's going on?
I think he has an infective exacerbation of COPD.
Good. He has known severe COPD, and based on his usual exercise tolerance and an increase in shortness of breath, sputum and changing colour of his sputum strongly suggests infection. The crackles on the left base suggest a pneumonia. So he needs a chest x-ray, sputum culture, a white cell count, and CRP. When you have patients like this, you need to ask about increased shortness of breath, change in sputum volume or colour, and fever. And if they have two of the three, then antibiotics are indicated. He has that. So I suggest that you start him on Augmentin Duo 40, along with increased NEDs and oral prednisolone. Okay? Bill, we need to put you on some antibiotics.
Fine.
So we'll just stop there, and you may be able to guess whether this is the ineffective or the effective one, but rather than, I'll get you to provide some feedback about what you thought, were there any of the adult learning principles? So the learner, this is the teacher. Did you see any of the adult learning principles that we discussed used? Did you see any techniques that were ineffective in your opinion?
The way he gives the idea, like the answer, it's just like give that direct answer without leaving her have the opportunity to think or to process.
Yes.
It's quite mostly in the voice, tone as well.
Yes.
And it should not happen in front of the patient.
Yeah,
Learning
absolutely.
activities is not in the same room with the patient.
Yeah.
Then it's not give a chance.
Yeah, it's not good practice, is it? So if I'm speaking with a student
In
about
front
their
of the
performance, I would always leave the room and then
Yeah.
come back to the patient at the appropriate time that I agree. So that definitely not in front of the patient. You also mentioned that you didn't really give her opportunity to find out what she knew. He asked one question and then he gave her the rest. Any other thoughts? And I think you said something else about thinking time as well, giving her time to reflect. It was quite a tone of voice you mentioned as well. Yeah. Any other thoughts? This is obviously a little bit more dramatic, although I've seen this, I see this regularly in the wards when we're busy. We all tend to default to be more directive with our students. Yeah. But is it a helpful way to learn? Probably not. Anything else that you picked up on?
Yes, so the principles is when we need a feedback or debrief and this matters. So principle we should leave the learner to share their ideas, the thinking,
Yes.
and remind them, help them, give them opportunities to remind them to critical thinking and then.
Yeah, you're right. And there was no feedback at the end. So yes, you can get them to present, but then, hey, how did you think that went?
Yeah.
Did you find anything challenging in doing that? So there was no opportunity for a debrief or reflection on their performance. She was just given a list of tasks to go on to. And she was, again, the way it was delivered with the speed and the tone of voice, who knows if she would remember those tasks, because she didn't think of them herself. She didn't come up with that learning herself, so it would be quite challenging. She's got a notepad. Do you think she's going to remember all those things all those instructions? Then she's going to get in trouble for getting something wrong, isn't she? Yeah, so let's see if the same doctor in a different scenario can do a little better.
Well, what do you find on examination?
He has increased pulse rate and respiratory rate. I couldn't see anything with his JDP. His chest is hyperexpanded and he has prolonged expiration and crackles at the left base.
So, what do you think's going on?
It could be heart failure,
Anything else it could be?
could be an infection.
So think about the two possibilities. How do you decide between them? What supports and what would be against the diagnosis?
For heart failure, I would look at the heart size and peripheral edema. He did have tachycardia. Couldn't see anything with the JVP. However, there were crackles, but I thought that was only on the left base. And the chest pain could be ischemic, although that was only mainly when he was coughing.
Good. An infection?
For infection, he is known to have COPD, and there is more shortness of breath and more sputum, and the sputum colour is yellow, and there are crackles which could be due to infection on the left base, which might also explain the pleuritic pain on that side. So I think an infection is more likely.
Anything against it?
Well, he did have a fever, so he could have been on antibiotics prior.
I agree, infective exacerbation of his COPD is likely. The crackles at the left base suggest a pneumonia. So, what would you do now?
I would do a chest x-ray, a full blood picture, a white cell count, and a CRP. I think he needs to be on antibiotics, augmentin, and I keep him on his usual puffers as well as subutable meds. And I think in this case, given the evidence, I put him on a short course of prednisolone.
Will any of those investigations give a diagnosis?
The chest x-ray will, but I think all the rest will support the diagnosis.
Yes, I agree. I think a student culture is important, especially if they're sick enough to come to hospital, and it's important to get that off before you start the antibiotics. Now, is there anything else that you're unclear about?
Just with the exacerbation of the virus, I'm just not really sure when to start the antibiotics.
We need to ask about increased shortness of breath, change in sputum volume or colour, and fever. And if they have two of the three, then antibiotics are indicated. And the antibiotics guideline can guide you what you use under different circumstances. Okay? Now, would you like to explain all that to Bill?
Okay, Bill?
And Bill, just before, if there's any questions that you have after, just ask.
Okay, so what did you think of that one?
He asked clear questions so the student can give answers and reflect on what she found.
And she ended up knowing quite a bit, didn't she? She did pretty well.
I like this technique. Okay, the teacher give the question and give stimulated the learner to think about the solution and things. For example, what against present silence. I think it's
So rather than saying you're wrong,
Yes.
or, you know,
I
you're right,
think it's effective. Yeah.
almost getting her to argue, not argue against, but
Yeah.
to think about the
Yeah,
alternatives. So it was very learner-centric, wasn't
Yeah.
it? Drawing her out. Any other thoughts about it? Did you like his tone a little better?
Yeah.
He's a little more friendly.
Yeah, yeah.
She felt safe to ask a question, whereas she
Yeah.
didn't look like she was going to ask a question.
It's more encouraged. It's more encouraged for her to talk, and then I guess it's two-way communication.
Yes.
So he gave her a chance to ask the question as well, not just by himself. Like,
Yes.
he's not just asking.
Yes, and of course he still did do it in front of the patients, so
Yeah.
that would be an area that we all agreed we would do differently.
Yeah.
But, yeah. Any other things that you liked or found effective in that technique? Any of the other principles that we were to look, I can just, all over that. Any other things that you saw? There was some time for reflection, gave us some feedback. Certainly facilitated the learning.
Somehow.
He probably did some connecting of the content. I don't recall the specifics of it, but maybe a little bit, this provided some resources and opportunities for extension and further learning. So you have the antibody guidelines can guide you if you're in a similar, this kind of connecting. It won't always be the same situation, but here's something that you can do. We agreed it was more learner centered. I think the relevance he could have provided a context, more of a context of why it's important to understand that. He possibly didn't do that as effectively. You know, if we don't get this right, this is what can happen. Not in a scary way, but I think that he could have contextualised why it's actually important to decide the time. He said you must get the student before, but it didn't say why. Why do you need the student before you start the writing? It might be obvious. I'm just drawing a, you know, if people understand the broader context and implications, they're going to remember those take-home messages a little better.
Facilitated learning was on the back side, you write on the real patient also. It is also the side of the facilitated learning, what?
It's facilitating the learner's learning,
Yeah.
So rather than, I mean, it could, if I'm understanding correctly, you want to facilitate the patient's learning too, so the student's now going to go and teach and educate the patients, so you would want to facilitate that. And I liked how at the end he said to the patient, if you have any questions after she's explained, please, it's okay to ask questions. And that empowering and creating that psychological safety to ask questions, that's very much the role of the teacher to set that foundation. Any other thoughts? So we know that you, in the planning learning session with Connie, you understand and you would have gone through the concepts around why it's important to plan. I find that when I'm busy and rushed and I have lots of students and I'm on a ward and all the clinical priorities that happen, I'm not thinking and planning my learning, and so I consequently don't always do it very well. To do it well, even if it's a short section of teaching, teachable moments in a busy clinical environment, we may only have 5 or 10 minutes to teach the students. But if you do it well, that will be 5 or 10 minutes of very valuable learning versus the kind of example we saw in the first video that we saw. So the challenge is really to prepare, to be aware of our learners, learning the gaps that they have, things that aren't covered well in their curriculum, to explore, to understand their knowledge and skills that they bring into that environment, and to think about what knowledge and skills we're trying to impart through that content. So I want you to think about that as we do our little impromptu teaching session in a second. So whatever time you have, be clear about the outcome that you want to achieve. When you've only got 5 minutes, you don't want to be trying to teach them 5 things. You probably want to teach them 1 thing. You might want to use 1 or 2 of the adult learning principles, not all of them at once in 5 minutes. So I'm going to give you some time, 5-10 minutes. You tell when you stop talking, I'll know that you're ready, or when you look at me, I'll know that you're ready. But take a little bit of time to develop. And I think we've got 3 pairs. So I think if everyone, and we can swap, if you're comfortable, we've got enough time that you each prepare a 5-minute session. I'm happy for you to do it in Vietnamese if that's more comfortable, teach each other. And you can prepare, and then would you like to just do it in pairs, or would you like the whole group to listen when you teach your partner? What would you prefer, to do it just 2 together, or prepare separately and then teach each other, but everybody watches when you teach?
I think we can do it in pair, so
Okay.
more interactive, and then
Yes.
3 group we can
Yeah.
show.
So take 5-6 minutes now to prepare a teaching session, and you can use I'll show you the set teaching dialogue. So I think you would have seen this in your online learning, this technique, and there should have been a handout on this. But essentially, we're going to, in the small groups, I want you to think intentionally about how you planned your teaching using these 3 steps. And then at the end, you're going to use the positive critique, and you're going to ask your partner that you're teaching, what do you think? So the person that's been taught, you'll ask the teacher, what do you think worked well? And then they'll give you feedback on your teaching. So this is a peer teaching exercise. What I noticed was, and then you're going to ask, what could you improve? And then you say what I think might help you. So it's a 4-step process. I think we'll go a little bit more through the set dialogue closure towards the end, but setting it is the planning, the dialogue is the conversation that you're having, and then the closure is this positive critique around what went well, but also some key take-home messages for the learner. So have a go, I'll give you plenty of time. Probably easier to pick a topic that you're comfortable teaching, but most people try to teach too much in 5 minutes. Just pick one thing that you'd like to learn, something about adult endocrinology that the pediatric endocrinologist doesn't know. whatever you like, whatever's relevant to you.
So 5-6 minutes just for preparation.
If you want to do the quiet preparation, using the set dialogue closure, and then you can do you have 5 minutes to teach each other, and then the other person teach. So you have 10 minutes to do this activity, 5 minutes to prepare. We've got plenty of time. Connor doesn't start the next session till 2:15, so if she gets back in time, otherwise I will start the next session at 2:15.
So we will present like demonstrate our teaching for the other group to do as well.
Well, that was what I was asking, whether you prefer to do the presentation as a group or just to each other. And I heard you say to each other, but what did the others think? Would you like, we have time if everyone wants to present and get feedback from the whole group, but it might be easier to do it together.
The whole group.
Whole group? A vote, put your hands up if you like the whole
Whole
group to
group?
listen.
I
split.
We prepare in pair, we can
Prepare in
propose for the whole
pairs.
group.
Yep, that's fine. Or one of the pair can present to the group. I don't want anyone to feel uncomfortable. This is for your learning, not to scare you. Practice in pairs, present for the group if you're comfortable. If only one of the pair wants to present, that's okay too. Okay? If you have any questions, just let me know. You've got the worksheets there that help you a little bit. You've got a copy of these,
Yeah.
Yep.
Chuẩn bị một cái giờ cho nó, chuẩn bị một cái giờ cho em nhé. Và sau đó sẽ gõ cái em giờ cho nó.
Bây giờ cái thứ hai không ăn được.
Yes, so just want to clarify, so this teaching is just clinical teaching or any topic?
You can do what you like, but usually it's something you would normally teach, because that would be more authentic. If it's something that you teach or a topic that you're comfortable with, so otherwise it's a little bit difficult, isn't it? So yes, a clinical teaching topic that you would normally teach.
Yeah.
But picking a small component for 5 minutes.
Ví dụ như anh sẽ dạy em là anh làm cái tiêu về phía anh sẽ dạy em nhận cái này về cái này rồi như này có cái biểu hiện trình đoán thì sẽ tiếp tục về nó sẽ cái bệnh mà đấy là em sẽ đến đấy sau đó kalau anh sẽ dạy cho em khôngบอกเลยcả anh dạy em con cả em là em đi cho em cho
Các bạn hãy đọc thôi, mình nên vào shop đó, shop bên đàn bài các bạn hay đàn shop rồi tiếp cận shop
the critique for the teaching Chinese, right?
The critique or the teaching?
For teaching Chinese.
The teaching.
For teaching technique, for the learner, for the teacher. Right?
Yes, so we're trying to develop your critique. It's for the person that is observing your teaching.
Yeah.
The person you're practicing teaching on, they're going to practice giving you the feedback using that critique. Is that
The
clear?
feedback around the way that I teach my
Yes,
students.
yes, so they're going to ask you what went well, or what, yeah, they're going to practice the positive critique.
The student is,
So you're going to take turns, so you'll both teach, they're not, neither of you are students, you're pretending they're your student, but they're actually your peer giving you feedback.
yeah.
Is that clear? Yes. Okay. So the beginning with my senior, my student first again. Hello. So this patient, with 30 years old. She has a pregnancy at 35 weeks. So she was treated with edema and fuel renal. So I'm not sure if she has epilepsy or not. So please let me know what should we do now to know if she has epilepsy. Yes, epilepsy may have.
What is the outcome of this lesson?
Okay. So, năm sau mình phải cần cái khám cái gì để mà mình tiêu chuẩn là cái gì là không cái này không phải đây là mình đang xây dựng kịch bản, mình đang xây dựng kịch bản để cho mọi người sẽ biết cách giảng dạy. Ví dụ như là phụ huynh có thể là suy tim hoặc là bị bệnh thận rồi đó. Okay.
Anh nghĩ là bệnh tim nó phải là có thể là thai, có thể là tim hoặc là nhân thận hoặc là được rồi.
Sau đó mình lại là có vấn đề là tim sẽ bị chết. Và mình thì làm sao cho mình làm cho bạn thì sẽ gì và sau đó mình sẽ thực hiện cái tiêu chuẩn của bạn thì sẽ là như vậy. Và bây giờ chúng ta mình sẽ số ra cái kết quả và cần phải là kết quả, tức là mình đã làm gì sẽ được rồi, còn một thứ gì mà sẽ được rồi, nhưng mà giờ em khi cái này thì em chưa biết cái kết quả, em chưa biết kết quả về cái em chưa biết cái khác, em chưa biết cái câu thêm nhiều, em chưa biết kết quả này, thì sau đó mình số ra thì em được cái tiêu chuẩn này rồi sau mình sẽ có cái tiêu chuẩn này. Hoặc là cũng có thể có một cách dạy thứ hai là mình dùng cách tới luôn nói thẳng nhiều cái gì mình vào số thì mình sẽ làm 15 bây giờ phù hợp chỉ dưới cái quá trình tăng cao sau hàng mình làm cán bộ tiêu chuẩn sẽ chậm như vậy thì nó không có hiệu quả làm cái gì là thấy chưa? Cái con nếu như cái cách bắt đầu thì nó hiệu quả rất là và những con này họ sẽ feedback về cái cách làm như vậy. Đó là cái kịch bản của mình, trong kịch bản của em.
Là một bệnh nhi tại phòng khám sau 2 ngày mình đi 3 tuổi, bây giờ là em 24, nó là cái lộ trình 24, em đã học bằng thuyết về sốc và em là những mà quyết định sốc, đó là bắt đầu từ bắt đầu. Và khi thầy xử lý thì nó nói bình thường thì khám rất là khoan, và khi em nghe những cái thầy nói thì em đã nghĩ ra thì
Nhưng mà em đề xuất mình làm cái gì?
thì em nói là tiếp cận ban đầu, tiếp cận ban đầu là khám đó thầy.
Tức là em hỏi là physical examination tức là khám thực thể trên mình nhưng
Và
mà
có thể đưa ra chỉ định hành vi.
nhưng còn mình lên mặt khám.
Thì thầy làm khá là ô, mà demonstrate là mô tả những cái thứ khác mà thầy thấy và những cái xét nghiệm gì thì nó sẽ em sẽ phản hồi cho thầy lại là những cái bên cạnh mà thầy chưa biết gì. Thứ hai là xét nghiệm của thầy các bạn có được chưa biết gì, nghĩa là bắt được thầy trực tiếp. Như vậy là hỏi thầy nên tóm gọn lại là cái lần sốc này thì thầy sẽ làm những cái gì quan trọng và không phải là cái gì, chỉ định xét nghiệm như thế nào, tóm gọn của bài hôm nay là outcome thì được tốt. Nói đầu thầy là thầy là sẽ biết cái bài mình sao, nên mình sẽ xử lý bắt đầu không phải là điều trị hẳn một cái bệnh thể, có nghĩa là nó sẽ phù hợp với cái bối cảnh thầy đã học rồi, thầy đã học bài sốc và đã một cái công tam hay cái bài cái bệnh sẽ
We have a few minutes. I don't even got it all sorted. Would you like a few minutes?
You're okay? And waiting for someone to come.
Yes, good for who come back?
You ready for should we give her a couple of minutes?
Yes, okay. Thank you.
Sorry, I'm just going to have something urgent. There's a grant deadline that I'm just trying to, I just don't want to multitask on it. I said I would do something for somebody and I haven't done it.
Yeah.
So who would like to go first?
So, I'm volunteer.
Yes, and would you like to teach? It's okay if I don't understand it. Would you prefer to do the teaching in Vietnamese?
No,
Or
we
do
do
it in
in
English?
English.
Well, let's go.
Yeah.
Okay. So you're going to be the yes, if you'd like to stand you can, or we're happy to sit. And but you teach your colleague, or you're
yes.
going to teach the whole group?
I teach my colleagues,
Teach your colleague. And we can, and I'm going to ask you all to use the positive critique structure when you're giving feedback. We may not all give feedback, but we can all take turns of giving feedback. Okay. Thank you.
I think we should stand up because there's the
Yes.
question here and
Yes,
there's a stand up.
please do whatever you're comfortable, however
Okay.
you're comfortable to teach.
Okay, hello. So, we have Miss Cherry. She's 30 years old. She presented with, she had now the pregnancy at the age of 35. She presented with well in general, and I saw that she had the Dulles edema. So, could we think about the cause of Dulles edema?
Because in pregnancy and well control the picture, so maybe the cause involving the baby, maybe most I don't forget the other cause such as heart failure or the edema from the kidney. So I think 3 main causes.
Have you heard about pre-eclampsia before?
Maybe this syndrome is involving the baby when she gets pregnancy.
Yes. So if you haven't heard about pre-eclampsia, so you know, so what should we do now with the patient to confirm this diagnosis?
Maybe to diagnose this, I must measure the blood pressure, and I must do the test, using that to detect protein urine.
Yes.
And maybe I should do a CBC to see the platelet cutting, because if the platelet is reduced, this means maybe health syndrome.
Okay, excellent. So we have also the blood pressure. This early morning, the blood pressure is 180 over 90, and she has the positive proteinuria. So this means, you know, so now we have enough the criteria for the diagnosis of pre-eclampsia based on edema, proteinuria, and high blood pressure. Okay. Okay.
Thank you. So, someone from the group, would you like to use the positive critique to give some feedback on the session? So, and you don't have to do a case-based session, but this was a nice, you know, here's a scenario and ask some questions. So, what would you give some positive feedback? So, you have to, so you're going to say, first one, what do you think worked well in your teaching session?
Deep wells was so pre-eclampsia is so diagnosis of porosity is a skill that my student must practice, but she has not met this patient before. That's why today I give her the opportunities to study this practice.
Okay, so you feel like a positive thing you did was providing an opportunity to practice the diagnostic skill.
Okay.
Yeah.
And the second thing is that so at the beginning, so I show her the one very common symptoms, so edema, and I did not really talk about the pre-eclampsia. So I give her opportunity to recognize if she has know about the pre-eclampsia, if she has the content connection between the symptom and pre-eclampsia.
Yes.
simply given her a common symptom and
Yes.
seeing if she could link it to the diagnosis.
Yes.
Yeah, excellent. And would you like to ask them this question? So he said what he thinks worked well.
Yeah.
And you can say what you noticed. If you're comfortable, you can all say what you noticed about the teaching.
What I noticed was the teachers have effective communication skills, so they use two-way communication and then have time for the student to get feedback and then reflect it for the question also about the case.
So good use of
Good use of the
reflection and feedback.
Yeah, and communication skills.
Clear communication skills. Yeah. What did others notice? And the idea here is that you're giving positive, this is what you think you did well, and I've noticed these positive things, so this is not the part where you say, I think you need to do this or that. So did you, Danny and Lee, did you notice that was positive about it?
I agree with the method. It's feel very like, smoothly between like the kind of feel like from the teacher and the
Yes.
student, so
Yes.
the conversation
The exchange was comfortable, there was
Comfortable,
flowing
yeah.
back and forth, it wasn't
and very comfortable environment.
Recommend communication skill is very good.
Yes.
So I think it's what I noticed was it's not just the verbal communication, also like his gesture and then eye contact.
Yes.
So
Body
it can
language.
provide body language
Yes.
can provide like safe environment and then give the confidence and
The reassurance and the encouragement, yes, I like that. You were the learner in this scenario, how did you feel? What did you notice?
I think that he good teacher said we are confident to say
You
anything
felt confident?
and
Safe to say anything?
maybe I made mistake. I have a mistake, but
You
it's not.
may have made a mistake.
Yes, but it's no problem. Okay.
It was okay to make a mistake. That's awesome. That's what you want your learners to feel safe to make mistakes. That's how we learn, isn't it? If we're too scared to make a mistake, we won't learn. We'll just be thinking about how do we avoid making a mistake. Any other feedback that you noticed in that session? No? So then perhaps we could say, what could you improve?
So I think that we should improve two things. First, I let her measure the blood pressure, and then she can have the real better blood pressure, so help her to more effective in skill learning.
Yes.
And the second thing is that I to show her the official guideline
Yes.
related to the ALC diagnosis,
Yes.
and help her to have the confidence of the knowledge that I showed her.
Excellent, excellent reflection. And then what I think might help is, does anyone have anything to say that might be helpful? So he's reflected that he could have given some additional resources, that agree that letting her take the blood pressure, most students want to have seen a blood pressure of 180 systolic, and that would be something they would remember, and they would think, okay, high blood pressure in a pregnant woman might need to be thinking about preeclampsia. That active involvement in the learning will have a more profound impact than just saying 180 on. And they may even miss the 180 if they don't pump the cuff up enough. So that experiential learning is very helpful. But in terms of the technique, did any of you notice anything that might be helpful for the doctor to include in his teaching next time? I understand you may not want to say anything other than he's an excellent teacher, especially if he's your boss. But is that we can all improve, and we're all lifelong learners. I think we're mostly in education because we love to learn. Is there any constructive feedback that you would give? Do you feel the amount of content you tried to teach her in 5 minutes was appropriate to the time frame? Did you feel comfortable you covered? In fact, I don't think you took it for 5 minutes. I think you were even quicker than 5 minutes. I think you picked a chunk of information. I'll go back to telling you what I think you did well, not what you could improve. Does anyone have any constructive feedback?
What I think might help is like we can provide clear learning goals about the case, like what we expect to learn from the case, and also like when he finished this session, he can ask like what your take-home message or what you learned from this case, and also like in 5 minutes like the topic cover. Maybe if he want to put a little bit like extra, so it can cover like a little bit more content to expand and then to keep it deeper for students. This depends.
So that closure is that segment that was missing and we didn't put there, but we talked about it next time. But asking the student to reflect what the take-home message was would really capture whether she actually had got the key message. So setting your learning objective at the front and then at the end seeing whether the take-home message actually matches what your learning objective had set out would be helpful. Terrific. Would you like to have a turn at being the teacher, or would you like to pass to one of your colleagues?
Bây giờ em quay lại dạ mình highlight mình xem cạnh lọc hạt dạ để em cho feedback.
Okay, I'm a teacher.
We're going to teach. Excellent.
Okay.
You sit or we stand up? I stand up, okay.
We've been sitting all
Yeah,
day,
I don't know
so
my
just
teacher.
try to stand up.
Yes, okay. First, this is a classroom to our patient pediatric examination.
Yes.
This is a patient 3 years old, come to hospital because fever 2 days ago. You have learned the lesson fever insurance last week. Now you apply the knowledge to approach the case to demonstrate what step you should do when physical examination is present. I remember you are the 4-year student and I apply your knowledge properly. Okay?
Yeah.
Can you start demonstrate what step when physical examination?
Yeah. So on the physical examination, so that's when the first I do the history taking, and then I do the physical examination. So based on the history taking, so I will start with the system that maybe it is the illness. So the patient has the cough. That's the first I focus on the lungs examination, and then I do the general physical examination. Yes.
Okay. Can you tell more about the organ or the system you physical examination?
So as I mentioned before, so because the patient has the fever and cough, so I focus on the respiratory system, particularly the lungs. Yes.
Okay. Accurate before because some children come to hospital because only fever. But as a physician, the baby come to fever plus cough. You can focus on respiratory system. But don't forget other system is very important. For example, neurological system. Ear and nose and teeth, for example, is very important because when you diagnose pneumonia, normally lays 1 or 2 days, this may be not discerning severe complication. But if you skip the skill to chat about the neurological infection or not, it may discern severe complication and you should be feel listening as my best for the children.
Yes.
So now you tell me again what should you do next time to do better or to improve the skill when examination?
Okay. Next time, so I think if the patient has the fever and cough, so we do not only focus on respiratory system, or physical examination, but we also focus on the other system, particularly ENT and neural system.
You should examine on system.
Yeah.
Not only the system demonstrate the symptom.
Yeah.
Okay. Thank you. And what should you take now at this lesson?
So her message is that so when we do the physical examination of the kids, we should examine in general all the system.
Thank you.
Thank you very much.
Great, thank you. Who would like to take the lead on the positive critique? Would someone like to just lead that? Would you like to? Put you on the spot, ask the first question? So we're asking
When the teachers assess the situation quite well, because they.
Oh, so you're going to ask her, first what she thinks she did well, so you give her an opportunity and then you add, because otherwise if you tell her then she will be just thinking about that, but asking her first what she thinks she did well is a really nice way to start. It's one technique, it's not the only way to do things.
So what do you think you did well when you teach?
Maybe I plan the scene clearly for him. So I give the outcome very clearly to approach the children. And maybe I give feedback how to improve and how and the message for him focusing in positive the strong what to do next time.
Okay, there's some clear needs, some areas to improve. What could you say back to what I noticed was, so what did you notice that was positive?
What I noticed was the teachers also have good communication skills, so have patience, spend time for students to respond, and also provide students the opportunity to get feedback. And also teachers ask about the take-home message, what you learn from the case, and provide a clear outcome about the information on the case.
Yes.
To the context for the context for the student.
There's context, yeah, that's terrific. Any other feedback that you noticed? Anyone else like to provide feedback? No? Okay. And then we ask, what could you improve?
Maybe I prepare maybe the standard question, for example, to observe what she do in the practically. Okay, so maybe I can feedback him exactly.
Yes. And what I noticed was, or what I think might help is, sorry, my name is not turning very well, being clearer in your scenario, and it may be that I didn't pick up everything that you said, but there's a potential to mislead your learner, and I don't know if you got a little bit misled by there was a clear focus with the cough, and sort of drawing out that differential of if it's a young child with a fever and no clear focus, you've got to look very widely because you might miss really serious things. With a focus, they're still a young child, they can present, they often have coughs and intercurrent illnesses, but painting that context to someone who's not a paediatrician to understand the difference between when there is a focus and there isn't, and the age of the child as well. So that's not about the content, it's probably more about, I wonder if you unintentionally confuse the learner. Maybe you didn't feel that way. And the take-home message, you kind of repeated, you ended up repeating the learning and the take-home message, you said the same thing for it. So it's framing the what did you learn and what's the kind of one thing that you're going to take away. I think you can differentiate those a little bit, if that's clear. But the STEM, like this, clearly when you're setting that learning objective, it could be, I want to teach you the importance of not missing important diagnoses in young children with a fever, because they can present with one symptom, but they actually have something else. I think that was the point you were trying to get across. Yeah. But I think you probably got there. Did you feel like you got that point towards the end?
I think I got so when I was at the Jewish patient with the cough, so the chikungunya cough fever, we should do the physical examination on all the system to avoid the diagnostic missing.
Yes. So you did get, that was the point you wanted him to get to, isn't it? Yeah. I think it was just like setting the learning goal up front isn't about just this case. It's you want him to think that fever in a young child it can have far-reaching implications. I think that's probably, so being clear on what your learning outcome was. It around what systems to examine? Was it about not missing important diagnoses? What are red flags in young children? So I think it's probably just being clear on what the learning objective was, would be the one bit of feedback that I would give. We are getting there with time, so perhaps if one from each group would like to present, we may not have time for everybody to, but would one of you like to present? Or you can arm wrestle and see who wins, and then you can decide who teaches. I see a finger pointing in your direction. Thank you.
But it's not about a clinical case.
No, that's okay. It didn't have to be
Whatever.
a clinical case. Just teaching something you feel comfortable teaching.
I wonder if this technique can apply in other subjects or only clinical settings.
I think it can apply in any teaching setting, really, but this is bedside teaching orientated, so I think it works best in a clinical setting. But I think you can apply it in any setting, because essentially, if I'm trying to teach you how to drive a car, and you don't know how to drive, and I say, well, what do you think worked well? And my teenagers will tell me, what didn't work well is you got cranky with me, or you gave me instructions too late, or do you understand? So I think you can apply that to any context, and then I can say, someone else can say, so I can say, as a parent, I might say, look, I think I was pretty calm and everything was good, but if the child doesn't think that. So I think you can use that framework for non-clinical things as well. Sorry if I distracted myself remembering back to when I taught my children to drive a car. It was quite a stressful time. I'm a better teacher now than I was then.
You just want to get to the chin on time.
That's right. Yeah. So I think it works equally well in any situation where you're trying to teach somebody something. So let's see how you go anyway.
This is in a practical classroom.
Yes.
Physiotherapy, so
Yes,
I think
perfect.
So hello, my name is Vic. So I'm the lecturer for the class today, and the goal of this class is for you to understand the importance of diaphragmatic breathing, and the way that I'm going to do that. So that as physio student, you can know about it, and you can practice it on patients in a clinical setting. So to get started, I just want to ask, how do you think everyone know how to breathe automatically, and they don't need to breathing, they can avoid like neck pain, low back pain, and anxiety for the whole life. So let's get start to see if it's true or not. So do you know what the primary muscle that will involve in your breathing? Yeah, diaphragm muscle as the name of the technique, right? So if the diaphragm muscle is not work well, so do you know what the other muscle will join?
Maybe the torso muscles.
Yeah, intercostal muscle.
Yeah, and belly.
Yeah.
Muscle in the belly.
Yeah, and also the upper chest. So you because of that, like you notice in some patients, like maybe COPD patient or patient with a pulmonary condition, so they will have some signs of soften breathing, so they will use the whole chunk to breathe, and from that they will have like less optimal breathing and affect their like can lead to low back pain or other conditions. So from that you see like how important of the right technique for the breathing, right? So now let's get to the practice one. So you can you place one hand on your breast and one hand in the belly. Okay, and you notice your breathing. So on my count, when I say breathe in for 4 seconds and breathe down for 6 seconds. Okay, breathe in 1, 2, 3, 4, and breathe down slowly 1, 2, 3, 4, 5, 6. So when you breathe in, you breathe in through your nose and breathe out through your mouth. Okay? Now breathe in and breathe out. Okay, one more time. Breathe in and breathe out.
I'm not getting sleepy.
So do you notice which hand is higher when you breathe in?
My right hand on belly.
Okay. So that's a technique for the diaphragmatic breathing. So when you breathe in, it's the feeling like you try to feel the belly in your stomach. So if you feel like the whole air, your hand will go up, and then when you press down. So when you practice that, do you feel like more relaxed?
I feel more sleepy.
And relax with, okay, so I think it's the teaching for you to know the importance of diaphragmatic breathing and technique to do that. So what do you want to promote it, what you want from this experience?
So I learned the principle movement, the technique of diaphragm breathing, and know how it to apply on patients, maybe especially one with COPD.
Yeah, it's wonderful, and you even think about like how what kind of patient you are trying to treat. So you can investigate more like how do you apply this technique for one patient, especially for the patient with pulmonary condition or even like cardiovascular condition. So it can help them to improve their respiratory vascular.
Excellent, thank you. And we all feel more relaxed now, don't we? So it's amazing.
I saw when she's teaching me, so Dr. Kung do the same.
Yeah, I was
He
doing it
actually
too.
joined with us.
Just like this for the whole class.
Before, good. Beautiful. Dr. Fung, would you be comfortable to leave the positive critique?
Yes.
Maybe 6
So, Jim, what do you think worked well?
So I think the thing I have done well is at first I have planning my class and my session, and I clearly point out the role of the class and also structure of the class to be like start with the question to make the curious student, and then share with them about the case if the patient has condition like respiratory or something. It's how difficult for them to breathe, and then from that they will like practicals, the real life they will understand why it's important. So starting with the why, and then you have more motivation to know about the technique. And I close it with performances and feedback and encourage the person.
So what I noticed was effective teaching is that so you spent you started to you begin to, by the way you remind about the knowledge of the diaphragm breathing mechanism, and then and after that you help your student to experience. So this technique, so I think is really good. So you can help your student to understand more the mechanism of this technique, and then your student do this technique.
I agree, and you were very encouraging. Did you feel safe and encouraged and like you had done something good? And we all felt very relaxed, so thank you for that. Any other observations of what she did well? What you noticed?
Yes. I think the student really engaged in her class because it's active, very active in her class. The interaction between her and the students, we can see it from Dr. Tong interaction. He do what
Yes.
he said.
She was engaging with the whole group. not
Yeah,
just
so
the-
breath in and breath out.
Beautiful, thank you. Would you like to do the next part?
Okay, so what could you improve?
I think the thing I could improve, so I can have maybe teaching at like photos and video to show the student like that's what people do, like maybe the patient how they will like the symptoms soften breath, or like what the normal people do, and the different. Like I will use more support tool to help the class more informative, and then
Yeah, teaching it too.
Yes, so what I think maybe help is you could tell your student to doing this technique many times more when she goes when she has time and
Practice.
yes, practice more times.
Encouraging practicing. Any other things that you notice that might help? I'm sure it's the language is difficult because you translate it in your head, but there was just one question that was more a yes or no question rather than an exploratory. I think it was the one, do you know what diaphragmatic breathing is, or something like that. It was a yes or no answer. It's a very small thing. I was having to try to find something to say because I have many more positive things to say, but trying to use open-ended questions. So what do you know about types of breathing? Or do you know, are there different types of breathing that you know? So a more open question that will allow her to come up with the two types. That's a small point. I couldn't think of anything else. We're running short on time, but we don't want you to miss out if you prepared something. So
It's quite challenging for us because I teach like research.
yes.
It's like a
We'd love to learn about research, wouldn't we? You can't do it in 5, you can't
Yeah,
teach
yeah.
about research in 5 minutes.
Yes,
You
it's
could
very
give you-
challenging,
you
like
could-
small
You
task.
could give you top 5 tips on how to get a successful grant application. We'd all be very interested in that. That's okay, I think because of time we'll probably move on as well, because I'm not sure how Connor is away. The next session we're scheduled to start at 2:15. I'll just finish off this one quickly, and then if I might just text and see how far away she is, or check that there isn't a text. and we can probably have bathroom breaks, stretch, walk our legs. I think we are very relaxed after that, and we probably will fall asleep.
We should have breathing session now.
Yeah, we don't want you to, yes, we could all go outside and practice our deep breathing and come back in, but also I'm aware it's a long day of teaching, and so just want to respect your time and give you a chance. It is quiet, I'll just check how far away she is. So at 2 o'clock she's starting, so she's going to be a little bit late, so we'll have a little bit of a break and then we'll finish. Also don't stress. Get started. We'll just wait till Dr. Tan comes back, I'll get myself organised. I think it's just a couple of slides left in this one. We have one more slide and then we'll take a longer break and start on the next one. Does your day finish after the next one? I think it does. You're not doing
We
anything else?
still have one session for resource.
Yes, the clinical skills one.
Yeah, after finish clinical skill, we have another session with the resource team. So a
With
three
the
person.
research team.
Yeah.
We're going to be exhausted.
Just so like research the idea and collaboration.
okay.
3:30.
3:30, well, we have to make sure we get to that.
Yeah.
Either way.
Because we also have online meeting with those in Vietnam group to join us.
Awesome. Awesome.
For sure.
And is it in here or somewhere else?
I think different room. I think we have to go back to
I'll have a look. Oh, you've got it
the
there?
room with first come, right?
Tuesday, 3:30. Oh, yes, Thursday one.
And it is nearly to the end, aren't we? We're just discussing that there's another meeting even after the.
At 3:30, right?
Yeah,
So
that's
it's
right.
3:30.
We want you to have a bit of a break. So we'll just finish this one off quickly. It's one slide and it's just refreshing your memory on the SET dialogue closure technique that we use. So the SET is really where you're thinking about roles. So the roles of the teacher and the learner or the patient, the outcome you're looking for, the linkages, the connections that we talked about, and whether the environment's appropriate. You know, you were discussing, do I stand, do I sit, where do I, in front of the patient, not in front of the patient. So the environment's important. This dialogue refers to questions, that we're using questions effectively, that we're checking in with the learner for their understanding. I heard several of you, do you understand? Are you clear on what I'm trying to teach you? Checking that with the learner, explaining the key concepts, stimulating their learning through the use of questions or connections, and then using time effectively. You all kept to time beautifully. And then the last one is the closure, reviewing what you have covered in your content, exploring, what else, any questions or follow-up activities, like you suggested some resources you could link them to, or some videos or teaching aids, and then the summary was the take-home messages, and maybe you might have a handout or something to go with that. So hopefully in this session we've explored our learning principles, we've used the SET dialogue closure, we've definitely had some practice with their teaching with some feedback using the positive critique, and hopefully increased your confidence with teaching. So that's the end, the same as before. If you can download your certificates, but you just have to complete the survey before they'll release your certificate to you. So I know you've taken a break, but would anyone else like a 5-minute break before we go to the next session? Or how are you travelling? Let's get your food away. There's no sugar. This is when we need sugar this time of afternoon.
And we so appreciate your time
You're very
You want to
welcome.
present your work?
Oh, that's very kind. Thank you. Well, I would love that, but I suspect I'll need to start the next session with you as well, because Connor's still about 20 minutes away, so I'll start the next session. Yeah, because it's, is that okay?
Yes.
Yeah, so, I think she texted at 2 to say she was coming back. She's going to be at least another.
So we can discuss,
10, 15 minutes.
yes, we
But
can
do you want
discuss
to
more
have a
small
break?
topic, so how we enroll the student, so play the role as the clinical training for the younger students, so.
For, you're talking about this teaching on the run training?
So
or-
to give us discuss about, you can share how we engage the older students to help the younger student in
So that peer-to-peer learning or the mentoring? Yeah, and we have some great examples of that at Bond in our anatomy teaching. We actually recruit the students that are 1 or 2 years ahead of our students, and they are given some training in that. I can put you in touch with Alan Sterling, who's a faculty member who takes them through a training program, and then the older students are actually teaching the students. Is your question how you engage and encourage the older students to do that? Because we actually pay them to tutor, but we would get the older students to pay them.
We want to know how to organize that. So that's it. I want to know so how you set up that. Does mean you haven't mentioned that. So the university organize the training program for the
Yes, we
students.
do a
and
day.
that is-
Yeah, so
Okay.
we offer it to the older students.
Mm.
They register an interest, they come and attend training,
Okay.
and then they are rostered to actually provide the tutoring in the anatomy lab. Informally on the wards, our clinical placement coaches program that I mentioned to you, the junior doctors, they're usually about 3 years postgraduate, they are paid for a day a week in the hospital to spend time with the students, help them become familiar with the placement environment. We provide quite a bit of training to them, we do coaching training with them, and so we provide the training and resourcing, and then they are in the hospitals helping. So they're in each of the disciplines, but they're not giving the discipline-specific teaching, they're not teaching them endocrinology, they're teaching them basic skills, history taking, examination, procedural skills, and also helping them to learn how to speak to senior colleagues and nursing staff and allied health staff. So it's more that near peer, we call it near peer, not peer, they're a few years ahead of them, but we are able to pay. I guess another question is how do you encourage that student peer-to-peer teaching? And you can do that through the group activities, but you can model that as well when you do peer teaching. When you co-teach, you're modeling that peer, what you can learn from each other as peers. So there's different strategies, I guess, depending on the scenario. Does that answer your question?
Yes.
So do we want a break, or do we keep going with clinical skills? Take a break as you need it.
Yes,
And we can stop early as well. We'll still give you the certificate, because you've done the online learning, and a lot of this one is practice. And I haven't prepared to teach this, so bear with me while I get the slides up. We can multitask, can't we?
Well, what do you find on examination?
Sorry, we don't want to do that again. Have you managed to do the online module for this one as well, the skills teaching?
Yes. We have finished 60% of the total online. Right.
It's a lot, I'm expecting you to do 4 modules, you know,
Yeah.
it's a lot. So maybe we're being too ambitious.
Because we must finish, so this 60% on the online, so we must, and then we participate into this offline course.
Yes, so you do the online course before you do the
Exactly.
face-to-face session. That's
We
correct.
must do that. We must do that.
You must do that,
Yes.
yes.
But it's useful, it's very useful.
I hope you found it useful. I wouldn't expect at your level
Yes.
that you will learn a lot, but
Yeah.
it is designed for more junior
Yes.
people who are learning education skills. So you might be a senior clinician,
Yeah.
but you haven't had any teaching experience, then it's suitable for you.
Yes.
At your level, I don't expect you to learn much.
Yeah.
Anyway, I'm still always learning things, so. Right, we'll make a start. I have taught this about a year ago, so bear with me while I find my notes.
Có research về nhi khoa này, cô em các em học sinh phẫu thuật để xem thử tại sao mà khi mà gặp những người trong khoa mà nó nói gì research hết.
Well, we'll make a start. We'll need to stick closer to the computer because I haven't taught this in a while. But so you will be more across it if you've done the online module. So hopefully, so let's talk about learning outcomes for this session. The main thing we'd like to teach you is a technique called the 4-step approach with feedback. So we'll practice that. We'll discuss how you might be able to apply it in your roles. We'll look at the stages of acquiring a new skill, and it's a beautiful introduction as you teach in the diaphragmatic breathing. So it'd be nice to contrast how you approach that with perhaps the technique that we will use today, and determine your competency and hopefully build your capability in teaching skills. So that's what we'll be working on. This is briefly a 4-step approach. So the first step in teaching a clinical skill is to demonstrate it. So you talked her through rather than demonstrating yourself to start with, but in this approach you would demonstrate it on yourself at usual speed, but you wouldn't say anything, you just show this is how you do diaphragmatic breathing and you would have done it. Then the next would you deconstruct it, so you'd say the steps to do it, and you still demonstrate it, but you're talking through each of the steps in the skill. The third step is to demonstrate while the learner describes the steps, so you're doing the skill, but they're telling you what to do. They're saying to you, breathe in for 4 seconds through your nose and breathe out through your mouth, whichever way you do it, I can't remember now. So that's the third step, and then the fourth is actually the learner demonstrates and describes the steps. Okay, and there's some evidence that supports that this is a good way to build new clinical skills, or new skills. You can use it to teach someone to tie a fancy knot with a rope, you can use it to teach someone to fly a kite. It's an approach, it's a deconstructed approach to acquiring a new skill. So the activity is hopefully you come prepared to teach a skill.
Yes.
Yes, excellent. And you're going to use this 4-step approach. And again, we won't take the time for everybody to do it. I'll ask for maybe 2 volunteers. And if you like, you could improvise and try and do your diaphragmatic breathing using the 4-step approach if you think it will work. Yeah, I think it will. Yeah, and I won't demonstrate because I can't think of anything on the spot to teach you, and I don't have my rope to teach you my fancy bow line. That's what I've done when I've taught before. Because the diaphragmatic breathing is reasonably simple, although to do it well is not necessarily simple, I understand that. But harder to sort of see, whereas maybe like you know, if you were teaching someone to insert a cannula, there are definite steps that they have to learn, and so you would put the cannula in without saying anything, they just observe you doing it, then you would talk them through while you do it, and then the next bit they would do it, but they would talk you through doing it, so you'd still put the cannula in, but they're telling you what to do, and then they're doing it and talking about what they're doing. So, did one of you, maybe one side of the table, did you have a skill that you wanted to teach?
Yes, I
Yeah.
can teach you both
Yeah.
skills.
So you're going to show her the skill first at normal speed without speaking, no commentary means no speaking, then you'll demonstrate and describe the steps, and then you'll demonstrate while she tells you what to do, and then the last one is she'll actually do it and talk about the skill. So what are you going to teach her?
Yes, can you do now?
Yes.
What do you need? I need to have a stethoscope.
Oh,
but,
dear, that must be difficult.
Let me see.
Can we
Maybe
pretend?
I think yeah, we can change it.
We all have good imaginations. I don't have a stethoscope here, I'm sorry.
Without any device is good.
Yes, is there something else you can think of that you don't need a device for?
Okay.
Do you have any tricks, like magic tricks?
No, okay, so she's my my student, okay. Now I teach you how to calculate the breath rate based on the movement of the abdomen wall. Okay. So the first step we explain for this we explain for the okay. So in the clinical practice, it's very common and necessary to calculate the breath rate. So there are many ways to calculate the breath rate, but so one common way is we look at the movement of the abdomen wall and to calculate the breath rate every minute. Okay, it's very simple. We expose the abdominal rate. You have a clock, and you look at the movement of the abdominal wave, and you base on the clock, and then finally you calculate the number of the breathing rate every minute. Okay, so we have a so now the steps of this technique. The first step you explain for the patient, and we get a consult from the patient. And the second step, we expose the patient abdomen wall. And the third step, so we look at the movement abdomen wall, and to calculate the number of the abdomen wall moving up and down every minute, and then finally you have the number of breath rate. Okay. Now I calculate I'm assure the breath rate, and please tell me which step I'm doing. So hello, this is the patient. So hello. Now could I examine your abdomen? So I want to calculate your breath rate.
The first step we explain to the patient what we should do.
Okay. So 1, 2, 3, 4, 5, 6, 7, 8. Okay, 22. So the breath rate is 22.
Then the next step we do count the abdomen raise. This is compared with the watch in 1 minute. The raise of the abdomen is the raise of respiratory rate.
Okay, now you perform on the patient and tell me the step that you do.
Okay.
You taste the step while you do this typical patient.
What's with the abdomen first? Should I calculate your respiratory rate by abdomen? The first I will observe your abdomen, and so I count the rate. Can you accept me to do that? Okay. The next time I will prepare the brush, and so observe the abdomen, and I count in 1 minute. Okay. The rate is 25 minutes.
Excellent,
Thank you.
thank you, and the patient, thank you. So perhaps we might ask this side of the table to take them to go through the positive critique. And so this would be in this case, Dr. Smith. He's our teacher.
So what do you think is work well?
So what I think is when I follow this structural 4-step approach, so what is
Yeah. What I would notice, what I noticed was the pictures have a clear demonstration what to do with the student to follow, like they know the procedure, what they need to do, and also the attitude with the patients in the picture, and also the clear communication.
In my opinion, teachers should spend time, but students can ask questions. Maybe I will ask about skill. Can I count in 30 seconds, so then I get the rate? Is it correct or not? Or can I
So
count
between
by
the steps, so between the step pause and say, do you have any questions about that? Is that what you indicate?
I have no watch in my hand,
That makes it
so
hard
I
to
have
No stethoscope is no watch.
I use the watch in the
Yes.
okay, is
Yeah.
it correct or not?
Yeah, no, that's fine. I think you made it up very well, so you
Yeah.
did well. Thank you. And the next.
How could you improve?
So I think I should improve is that on the concentration step 2. So at the beginning I should tell my student to know so how many stages general in this presentation. So this it has the total 4 stages.
Yes.
Total okay, we have a 4 stage and then and a stage 1, stage 2, 3, 4.
Yeah, so actually set the scenario for them. I'm going to demonstrate in your time, then I'm going to deconstruct it and talk you through each of the steps. Then you're going to, I'm going to do it again, then you're going to help me with the steps. Yeah, perfect. We might just bring Palmer in, kind of through all over the countryside. And kind of we do need them to have a little break and be at their 3:30.
Yes.
So that's why I keep going. I did not do the first bit where we do that in the schools that you teach. I just
Yes.
asked
No,
you to
we'd
first
already
step.
covered that.
Yeah, I figured you probably had, and so it's this side of the room's turn to practice this skill, and
Did you demonstrate it?
no, because I was put on the spot.
Of course.
I have no skills.
Yeah.
And no stethoscope. No, and I usually do a road trip or a paper trip or something, but I didn't have anything here to do it, so I didn't. Did you bring a trip to?
Mine is my usual yoga pose, so I can do that.
If you would like to, in fact, we had some diaphragmatic breathing, and we all felt quite sleepy at the end of it, because you were waiting for 4 hours, 6. So the yoga pose would fit right in the afternoon.
And what, we did our micro teaching?
Yes, we finished
Sorry,
teaching, yeah. So,
Good.
yes, well, I'll tell you after I'm leaving, it was all finished. I think they took our sugar away. This is the time of afternoon we need those chocolate bars, I think, to keep going, don't we? Or maybe it's just
Not
me.
like I missed it.
You do, me too.
No, I got some
Did you get some?
I grabbed, but there were lots left over, so I.
Right. Yeah, so, I'm happy to let you continue, and it's been a pleasure spending time with you.
Thank you so much. We have small gift to present to both of you, and we should have photo, even it's not finished, but because you live so.
Yes, let's have
Yeah. Let's,
I changed my shoes, I'm sorry.
Oh,
I
yes.
need to
Beautiful.
support my ankle.
We are very busy today.
I was trying to move the space.
Audra is busy every day.
Yeah,
I tell you,
yeah.
she's been running since I saw her there.
Yeah.
That's
That was, I think, a little bit sweet.
Yeah, I think that was it.
Aww, that's very kind, thank you very much. We so appreciate it. Have so easy for you. Yeah.
Thank you.
You should have a photo, and you have a photo. I love your camera.
Shall we do a group photo?
Yeah, everyone come.
Should we be in front of the projector? or-
No.
Yeah.
That one off? Okay. Well, this girl that knows how to do all this quickly. Projector off?
Yeah.
Want to do anything
Or you
there?
can move forward, so you don't need to be in the project.
Maybe down.
Oh, we get to hug each other all the time.
Okay. Yes, culture. 1, 2, 3. One more. 1, 2, 3. Yeah, you should come.
Selfie.
Yeah, I
You did very good.
Don't worry, I have
Take a portrait of you and etch you on the.
Yes.
Selfie, sure. I have all the
Tell us where
I
you
take it
stand.
closer. Hay là để lên trên cái base của thầy
Oh,
Khoa
we've
kìa.
got a selfie.
Oh,
Don't worry, I have all things.
You could teach us the skill of how to take a good selfie, because I don't know how
Using
to.
four-step approach. Exactly, skill of taking selfie.
Okay, perfect. Okay, wait, I put a timer.
Very
Cái
nice.
còn
Only
em
the
đợi
time,
trong
okay?
Thằng nó là bên kia, bên 3 người ấy.
Okay.
Hãy nhắm chỗ
5
cái
seconds.
mà bên
Yes,
kia
sir.
phải bắt thị á.
Don't trip over on your way back.
Okay, cool.
10 seconds.
Only 5 seconds. Yes.
Make sure that no one closes their eyes.
100%.
Check lại đi thầy. Check it. Oh, there's a meeting and
Chụp mấy cái
Hãy
link.
subscribe cho kênh Ghiền Mì Gõ để không bỏ
Không sao mình làm background cho mấy cái link.
The students. Awesome. We did a student focus group, and yesterday we had one student registered, and then we had to try and get more. Snowball, yes, it was snowball recruiting, and she ended up with 9 or so, which is a nice focus group size, so it's, thank you, yes, I'm sure there'll be some good feedback.
So I've got, you have, on this side of the room, have
Still have
a
to
skill
present.
ready to
Yeah, let me turn
to
my
reinforce
back.
that, right? Is that where we're up to?
Yes.
Okay, would you like to go straight into it, or do you want to do a bit of a breakdown of the, like, I know Michelle's obviously talked you through the process. How are you finding the process, this process? Does it feel?
It's very, I think your focus is clear.
Yeah.
It's clear. I think it's very useful to change the skill.
Yes.
procedure skill and clinical
Something
lessons.
practical. Yeah, I think it's
Practicals.
really well suited for
Yeah.
practical things, which
Yeah.
often require, like, you know, there's the muscle memory
Yeah.
associated, and so we get very used to just doing things. So this forces us to break it down, and that's why when I do this, the example that I often use is just a sun salutation.
Yeah.
Because it's supposed, I don't do as much yoga as I used to, but it's supposed that I would just do without thinking. It's just a sequence that you follow, not thinking, so it
Yeah.
becomes, so it becomes kind of automatic. And this forces you to break it down.
Yeah.
I often, when I talk about this 4-step process and I try to break things down, I think about the idea of, I dread teaching my children to drive, but that's the sort of thing where I've now been driving for, I
Yeah.
don't know, 30 years,
Yeah.
far too long. But I get in the car and I don't think, although it's interesting because I now drive, the car I drive mostly is an automatic car.
Yeah.
I learnt to drive on a manual car, and we still have one, but mostly my husband drives that. But now when I get in the manual car,
Yeah.
I have to go back to thinking,
Yeah.
because it's not my everyday,
Yeah.
now I have to actually engage my brain,
Yeah.
but to actually then think about, what's the step, and you've got to break it down, so it's that sort of unconscious competence, and we'll come to that at the end of this, but that's what this forces us to take a step back of something that you might do every day, and then, what actually, what am I doing?
Yeah.
How do I break this down to explain it to somebody else? So it's quite, it's a challenge, but it's fun.
But it is the negative thing is that, so sometimes one skill, but different doctor break down the different number of the steps.
Yes.
And sometimes it's confusing for students.
Yeah, okay.
You know what I mean? Yes, and for example, I participate to the teaching from you, and then maybe
Yeah.
Sunday I participate.
Michelle might do it
Yeah.
differently, absolutely. And that's where, like, it comes back, if it is a skill that needs to be done, or we want to assess in a very specific way, then that's where you come back to that idea of sort of that learning plan and being really clear about it. If it's a case of, it's okay to have variety, because students will be exposed to different people's approaches, then that can be okay, but yes, certainly here, like our on-campus teaching, this is a process that we've been trying to encourage all of our procedural skills tutors to use. And say in year 2, they're starting to learn, procedural skills and physical examination skills. So if you're learning a musculoskeletal examination, then we try to make sure that every student is learning it in the same way, and by teaching the tutors in this way, then we can do that. But in the clinical environment, there will always be some variety. So yeah, always way, but I think it's good for the more practical, the more content, maybe the micro skills model, the 3 sort of steps, but yeah, this is good. So you have a skill? Yeah, you want to have a go? I will stay out of the way. You become a teacher now.
Good Fatima?
Yes.
Okay? How this we have a bus?
Hello, so I'm a physiotherapist and a no instructor today. So today we will learn about the diaphragmatic breathing. So to get started, first please observe what I do, and we can talk later. Okay? So to do this technique, I have some steps. First, I put my 2 hands, the right hand on my stomach, and the left hand is on my chest. And I use the nose and mouth. So breathe in, and breathe in by my nose, and the air will come down. Just feel like feeling air stomach and chest, and breathe in for 4 seconds by the nose, and breathe out by the mouth for 6 seconds, and do it 3 times. Now can you please tell me how to do it and I will follow the instruction.
Okay, so first of all, I put
You tell me what to do and I will do it.
okay, so put your hand on the chest and on the belly. So then you breathe in by your nose when the air come down. So breathe in for 4 seconds and then breathe out for 6 seconds and use your mouth. And do that 3 times.
Now can you perform for me? So you can do and you describe what you do every step.
Okay, so first of all, I will put both my hand on the chest and on the belly, and then I breathe in with my nose for 4 seconds, and then I breathe out for 6 seconds and use my mouth. And then I will do that 3 times.
Yes, so you do a right technique, in the old step, but remember the size, like when you tell patient to do like guidance, so the size like when you put in, so the hand on stomach will go out, like your belly full of air, so just go out and it's full out, so that. So that's the size that you can tell patients for them to notice that they do the right or wrong thing. Thank you.
Very good.
Good. Positive critique from this side.
Okay, what do you think worked well?
So I think I follow the 4-step approach to tell my student what to do the technique. I use the clear communication, so verbal communication and also like non-verbal communication and body language and eye contact and everything else. And clear instruction. And also like I get the feedback for the student when finish, and also tell them what they will learn the first step.
So what I noticed was if a teacher does you applied really 4-step approach, so into the skill that you want to change in your student.
Yeah, great. And then your question.
And what do you think, how could you improve it?
I think the thing I could improve, maybe I can learn more techniques how to encourage my student to engage better. Maybe I can use something like more engagement for the student.
Yeah, excellent. And what we can help is start at the you should demonstrate clearly how many steps in this technique, and when you demonstrate, you should show clearly so step 1, step 2, step 3. So then just you can no more step. Yes.
Also, I think, as you say, finding it different, like, so, sometimes we get into our habit of using the words that we would use to describe what we're feeling and, tummy going in and out, and maybe sometimes different ways, like an analogy validity or that sort of thing that might resonate for our patients as well. Any comments or feedback from the others as well?
It's really easy for the student to get it, and because they will see the demonstration first and guess what step included in the demonstration, so they have to think in advance, and then they hear the correct demonstration and instructions from the teacher, and then they repeat themselves. I think it's really nice for them to think and to revise how many percent they correct with the description, and then how they remember. It's really nice. When they practice themselves, it's really good.
So it is a technique that I think is very much lends itself to the physical, sort of procedural skills, physical examination sort of things. When we have had people bring in skills to practice with, we've had all sorts of things from yoga poses to origami to how to fold a fitted bed sheet to all sorts of clever things that people do, and it's great to use it in that kind of non-clinical example as well, because it's it's just something that everyone then can relate to, and you're really focusing on the techniques in terms of teaching a technique. You're focusing more on the teaching technique as opposed to being able to any of us having a particular skill set. So I think that's important as well. One of the key bits of overlap, I think, with the micro skills and the 3 steps that you used previously in terms of the set, dialogue, closure, is that set. So what we're not showing here is the fact that I guess we assume that learners know why this skill is important. So I'm sure that Michelle talked to you in the last one about that first step of set is this skill is really important for you because you will learn that use this skill in this context. Here again, we make the assumption that the learner knows why and will use it, but obviously that would have to come in sometimes as well. Are there any bits of this that you feel maybe wouldn't work for you or that you find challenging? I feel like this approach really effective, but it's quite time consuming. So we can, I think we realize that we not apply it for every skill that we teach for students, because for example, my specialty is teacher something. We teach a ton of skills, a large number of students. So if we take this for all 4 steps, so much time and maybe in one session it cannot impact for everyone. So usually we make it shorter, something just
So once
two and two, something like that. So to combine. So interestingly, lots of people say that they like to kind of combine these. The thing that can make it really important to break it down is, and again, it's case by case. But if you are doing a skill, so say you're doing a physiotherapy movement technique, and it's low risk in terms of not really likely to harm the patient, then it's less of an issue than if you're doing, inserting a catheter. You don't want to cause harm or pain, so before you let a student actually practice on a skill like that, you would really want to make sure that they understood the steps. So that's where that formulation might be even more important. Being able to find the words, make sure they've captured all of the important steps, including any safety issues and that sort of thing. So you wouldn't want to let that one go in some contexts. But then of course in other contexts it might be okay. Then the other way to potentially find some more time when you have more students and a group is actually, and again it's a bit case by case, but if you have a skill that has lots of steps, to have the group involved. So rather than it be one-on-one with every individual learner going through the whole process, you can do the demonstration, and it's really important that the demonstration is in real time. So you might do the demonstration multiple times, because I'm sure yourself as a physiotherapist, there are lots of things that you would do, your hands would move really quickly doing things that a student would go, whoa, hang on, slow down. But doing it first in real time is really important because they then see what they're aiming for. They can see their end goal, and so that's great. Then it's about breaking it down. So we don't want to negotiate the real-time demonstration, and that's important that the pace is right. Then it's about breaking and slowing down. But if you get to number 3 and you have a group of students, you can then ask them to so step 1, step 2, step 3, and even with the demonstration it can be broken down as well. And then, or they can be doing maybe the performance part with pairs. I'm not sure if you do like peer-to-peer practice, but that's something that we would sometimes do as well before students had a practice with, say, a simulated patient. They might feel comfortable to do some peer-to-peer practice as well. So yeah, there are some ways to be creative, I guess, with it. Yeah, but that's a concern that lots of people have in that context of, well, we have a lot of skills, it will take a lot of time. But there are good ways to involve everybody. The others, there might even be some lab techniques that you can teach in this way. Actually, in my case, normally I will do the step 1 and step 2 together.
Yeah.
Yeah, I will demonstrate to my students, and together I will explain to them why I need to do like that, and how to avoid like contamination or something like that together, because our experiment is take long time, so I cannot do one time and do again.
Exactly.
Like
Real
so,
time for
yeah,
you is
yeah,
really
right.
different, isn't it?
Yeah. So I will do step 2 and step 1 together.
Yes.
And then step 3 is flexible. Like I can ask students at that time or after that. And finally I will let students do by themselves.
Yes. Yeah. And I think, as we say, another set of variables in terms of much longer and some waiting time in between as well. So real time doesn't make so much sense. You almost need to do the opposite. Like, here's one I prepared earlier, which has already been running for 3 hours or whatever it might be.
Sometimes my experiment takes 1 day or several days to finish.
Yeah, exactly. Yeah.
It's a little modified.
Yeah, and I think that's absolutely fine. It's, this again is, these steps are often designed for those kind of bedside teaching. So we're talking about something that you would do in a, a ward-based sort of situation, or physical therapy type situation. So it's, you have to, these things are never set in stone for every single situation. But I think it has its place for when we think about safety, like for a skill that requires patient safety and where it requires muscle memory. So we often think about the students often learn physical examination skills almost by the movements, the choreography, whereas this helps with that deconstruction, that, as you say, describing why, like what you're doing and why as you go, that can be really important as well, because it's not just a case of now I'm palpating here or doing this, this is why. I'm palpating here because this is where the liver is, or whatever you're describing, and so but that real time gives them the choreography, it gives them what they're aiming for, which is important. I'll move on. Does anyone have any more questions or comments about that process? The other thing, there's a note for me. The other thing that I think is really important in this kind of model is just the feedback and the engagement of students. So that's the positive critique model. What in communication skills, particularly when you've got one person and one learner active at a time, so you might do this kind of model with a skill. We would do a simulation with a role play with a simulated patient, and therefore only one learner at a time is engaging with the simulated patient. But it can be really helpful to allocate roles to the other students in the group, and that can be as part of the feedback. So you might ask some of them to focus on
the questions that are being asked, like the content. Some might focus more on the process, as in the way, the empathy, the picking up on patient cues, the engaging the patient. Some might pick up on the body language, the non-verbal skills. And so then when you have the feedback discussion, they know that each of them has something to contribute and something to focus on. They know what they will be asked to contribute, and they have that sort of active involvement. You can say to them, "Oh, this question, maybe that didn't go so well. Any thoughts? What would you do differently?" So just being, rather than it being who's got the spotlight on them at any one time, that you really do try and engage the whole group. So this is the stages that I kind of mentioned and alluded to in the context of driving, or my yoga pose that I would be able to do without thinking too much about it. So the consciousness and competence sort of scale. So initially you don't know what you don't know. So when you initially start to learn something, we have lots of medical students who come in and go, "I was a really high achiever at high school, I've got really high grades, yep, I can do this, I can do anything." And they often can get a bit arrogant because they think, "I'm smart, I'm good at this." And they don't know what they don't know. It's not until they start to actually get exposure to situations that they realise how hard things are. Suddenly, the light bulb switches on and they go, "Oh, I now realise that I have some gaps and that there's a lot that I need to learn." And this is a good place. We want them here. This is, not everybody really is there. Mostly people come into medical school pretty vulnerable. But you have those few that are a little bit arrogant. But so that conscious incompetence is, I am aware that I have lots and lots of gaps in my skills. Conscious competence is when you know you can do it, you're aware of it, you're probably still thinking though. So you're still mindful of the steps that you're doing. And so, I can do this and I'm confident, but I am, I could describe it to you without having to think too hard. And then we get to the unconscious competence. So autopilot is you've been doing it for so long that you do it without thinking. And the classic example is often I would, and lots of people do this, use your Bluetooth in the car to ring someone, talk to someone in the car while you're driving. And you talk and you safely drive and you get from A to B without any incident. But if you thought about it, how did I do that? You've just sort of been distracted, having conversation, and you've really done it without thinking. This is where it's actually hardest to teach a skill. So those of you, the more experience you get, the harder it is to go back to that deconstruction step and tell somebody what they need to do. I want my kids to learn to drive a manual car, but honestly, I will have to go, okay, now put your foot on the clutch, that's the left foot on the left pedal. So I will really need to think about that, because that is something that I've been doing for too long. And same with lots and lots of things that you would be really used to. So often it's here that we're in our best teaching space. But that's also partly why that 4-step process can really help us to break down, because it forces us to take our unconscious competence, if that's what we're at, and become a little bit more conscious of it. It's there, you can do that, but you just have to bring it to the forefront again to remind yourself of what those steps are, which requires reflection. So that reflective competence is when you go, okay, yes, let me have a think about what it is that I do, and how I can break it down. So in terms of determining competency, I don't want to spend too long, because I want to make sure that you can finish up before you're seeing your cat 3:30. 3:30. Yeah. So we've talked about assessment. We talked about this a little bit in the context of Miller's pyramid this morning. So the different levels and the way you would actually measure competency or whether. So we've talked about skills in this module, specific skills.
And the question is then, how do you know to what extent a learner has actually captured and is able to do the skills? So for all of this to work, we need to know what the expected outcomes are, what the expected level is, and we need to know the common errors to look for. So this is a nice framework to just go, okay, if I was going to measure whether a learner actually was properly doing, and instructing a patient on the diaphragmatic breathing, we would need to go, okay, what am I looking for? What are the outcomes? What's the level? So this is again an example of, say we're doing history taking. I expect that students in first year and to a large extent second year are still quite clumsy and clunky in their history taking. So they're asking lots of a list of questions. They might miss a few things. They mostly will capture the content, but they'll do it maybe in not the most patient-centered way because they're so worried about thinking about what question do I have to ask next and that sort of thing. So that's the level that I think is probably still okay for year 1 and year 2. So yes, the expected level, like the expected outcome ultimately is for them to be able to have a really nice, fluid, conversational sort of history taking session with a patient. But that wouldn't be what I would expect at year 1 and 2. So you have to understand, what level for now for this point. So, you will do your step 1, real-time demonstration, and it'll be fast, and your hands will move quickly, and you'll do all of those things. Is that what we would expect of a learner, even a clinical level learner? Probably not. They might still be a bit slower. They might be a little bit clumsy with their hands, but in general they will do the thing. And so you need to think about that might be the ultimate goal, but is that now or is it that after years of practice? It's also important to assess on multiple occasions with multiple people. So a student might be assessed, say doing a mini CX or something like that on catheterization, and they'll do it one day and they'll nail it and it'll be like, great. But if you only ever view and assess it once, that's a problem. That's, it may be that was a particular easy case, that, they had a good day that day, or it might be the opposite, that they have a particularly bad day one day, but that's not necessarily a reflection of their ability and their skills. So it is important to have a range of assessors and a range of time points. It's also important to know what you're looking for as far as, yes, the end game and the positive things that we're looking for, but also the common pitfalls. So if we can correct things. So it's not always just about the summative kind of punitive, you did this wrong and looking out for things wrong. But assessment is an opportunity to correct things, to provide feedback. It's assessment, we can do assessment for learning. And so we provide the feedback that then allows the learner to take that on board and do things differently in the future. So that's just a little insight into how we would then actually take a skill like that and make some decisions about it. Have you all been involved in some assessments?
Yeah.
Sort of clinical assessments. So, if you're doing an OSCE, that sort of thing, we have the rubrics, but we always need to know what level, what would be, and there might be some things that we would regard as, say, like a critical fail, where if they do this or if they miss this particular step, then that's a real problem. This is Miller's pyramid again, which I showed you this morning, so we know that that's that sort of entrustment gradations. So moving from the knowledge to the ability to apply that knowledge into a standardized performance, like say this would be like your OSCE type situation. This would be then performing it in practice, in like a WBA with real patients, and then of course feeling like they can actually go out and perform that unsupervised. So performance in practice would still be probably at the supervised level, and then unsupervised performance. And that is as we move up that capability, so that sort of developmental model. We increasingly in medical education talk about capability as opposed to competency. So capabilities are developmental and sort of ongoing. So it's less about ticking off. We still have competency-based assessments, which are, yes, you have to achieve this level and we tick you off on that. But there's the longitudinal development of capabilities, which are more, I guess, the bigger picture and how everything ties together. So that's about, I'll bring them all up from there. So that's about setting the performance goals, breaking the skill into discrete steps. So looking at capabilities, we can say, well, okay, that if we break it down into discrete steps, it helps us to identify where things might be going wrong, so we can support that. Providing practice opportunities, and that's about that appropriate level of challenge as well. So I can keep practicing the same thing and not get any better. It's not until I push myself a little bit further that I'm going to actually improve, which applies to so many things in life, right? Fit and able feedback. So that's an acronym that this health centre uses. It's funny because when I first saw Fit and Able, I thought, oh, I haven't heard that acronym before, but it's essentially the same things that I would teach in other contexts, and it's basically it's about saying that it's focused, so it's being very specific, focused on the task. It is, I'm trying to remember what the I is, it's timely, so just in time. So your example of saying that was really good, you know, but here's something that you might be able to do differently, is a good example of that timely feedback. I'm trying to remember what I'll find it for you, but the model is basically focused on its learner-centered feedback, it's specific. So all of the evidence in education tells us that the thing that makes the biggest difference for learners is getting tailored, individualized, and that's what I will be, individualized feedback. And it's also constructive, so it's not just, we don't want to say, that wasn't very good, you didn't do that right. We want to give them the direction, the support to understand what they can do differently to improve it. So that's what Fit and Able feedback is. I will send you what it actually stands for. And then allowing that time. And I mentioned that earlier as well. Sometimes we can give somebody feedback. We would say, how did that feel? How do you think that went? What might you do differently? So that problem solving idea. So this is sort of the positive critique as well. What would you do differently? A bit of problem solving. And then you can actually say, would you like to try it again? So if you've got time in the context that you're teaching, you can give that opportunity for reflection and then re-rehearsal so that they feel like there's been some success. So then, I think I missed the first start, but I think we managed to cover these learning objectives, hopefully. And so there's another QR code for you, and you get an extra certificate. Let me sign these. That will be the end. So you've got about 10 minutes, and I can walk you over to see.
For free resources.
Yeah, so you can find. So.
Do we need to have an account to access to the resources?
That's a good question, actually.
Yeah. We do. Yeah, I scan it and
But you, because you have the access to the
It's
online module, you may be able to access it through
use
that
the same code.
Yes, maybe.
Yeah.
Try that. If not, I can send you some things.
But we could only access to the first 3 modules, and the last one we could not access.
Okay.
Because we must
Yeah,
register
because you've not been registered for those.
Với lại ngày mai mình làm xong rồi mình có thể mua được cái phần mềm này. Cái tài liệu đây là đủ cái phần đó đó. Còn nào online, những cái cuối thì mình chưa mua được. Maybe after this one.
So, thank you everybody for spending the day with me. This is yours, and then let me see. We're gonna take photo. Oh yeah, with you.
So everyone.
Let me read the names.
There
Yeah.
we go.
Should you give the.
I guess, yes, let's do that.
We give liver for every person.
I will
and then we
deliver
take a
and you
photo
put
for
photographs
every
of delivery, let's do
individual,
that.
exactly.
Yeah, so that's very
Yes,
formal.
I'm the first.
The first student.
Okay.
Tập cái đó
You can, yeah, you find the right one.
Chị đặt tên cho
And I love your camera.
That's my
That's
yeah.
yours, I
Yeah.
like car, so cute. I did retro.
Bùi Thị Ngọc Bích.
Yeah. That is-
To go. I'm not helping you to go.
Okay, move toward this side, please. Yeah, okay. One more. One more step.
Yeah.
Did you want to turn to the beginning slide?
Oh, yes,
Slide.
The first one.
I'm just talking with quickly.
Oh, yeah.
And I'll come get you back from.
This one, I
Yeah.
The one that-
Again.
Okay, next one. Thank you.
Nhưng mà thì anh xem mà cho cái không
Thank you very much.
You were going first, but now you're. Thank you very much.
Perfect.
Thank
này
you.
là cô mình xem là
Then can you move this side please in the middle of the slide here?
có trên là một tình anh đi
That's my turn.
Okay, 1, 2, 3, closers. 1, 2, 3. Beautiful.
And then we all.
And do your own.
Không có đầu rồi nhé.
1, 2, 3, closers. 1, 2, 3. Okay.
Chị lấy một cái camera
And
để
then
ở đây.
all